Hi, my name is Ying Wu. I'm a postdoctoral fellow in the Department of Kinesiology at the University of Connecticut in Storrs, Connecticut. In this video, I will be overviewing the major findings from our meta-analysis titled Yoga as Antihypertensive Lifestyle Therapy, a Systematic Review and Meta-Analysis. And this paper will appear in Mayo Clinic Proceedings. First, I would like to acknowledge the co-authors on this paper, Dr. Blair Johnson, Dr. Rebecca Kupchak, Jill Livingston, Dr. Crystal Park, and Dr. Linda Pescatello from University of Connecticut, Holly Louise from University of Pittsburgh, and Shiji Chen from University of Michigan. In this paper, because the majority of the yoga intervention studies were published before the release of the 2017 American College of Cardiology and American Heart Association's definition of hypertension, we followed the 7th report of the Joint National Committee classification of blood pressure. And the take-home message from this study is that among individuals with hypertension, practicing yoga at 3 sessions per week can result in blood pressure reductions as large as 11 mm mercury for systolic blood pressure and 6 mm mercury for diastolic blood pressure, which equal or exceed the magnitude of those reported for aerobic exercise training. Very briefly, our meta-analysis included approximately 3,500 participants from 49 yoga studies published between 1983 and 2018 that compared a yoga intervention group to a control group. And because the blood pressure response to yoga practice in any given intervention study is influenced by multiple factors simultaneously, we performed meta-regression analysis, which is a similar concept to multivariate regression analysis, to identify sample, study, and yoga exercise characteristics that independently influenced the blood pressure response to yoga at the same time. And these characteristics are referred as moderators. So controlling for other moderators for both systolic and diastolic blood pressure, the greatest blood pressure reductions were reported among samples with hypertension, followed by samples with prehypertension and normal blood pressure. Controlling for other moderators for both systolic and diastolic blood pressure, the greatest blood pressure reductions were reported among interventions with the lowest tier of methodological static quality, followed by interventions with the middle tier and the highest tier of methodological static quality. Controlling for other moderators for systolic blood pressure only, greater blood pressure reductions were reported among interventions that specifically emphasized breathing techniques compared to interventions that did not. Controlling for other moderators for diastolic blood pressure only, greater blood pressure reductions were reported among interventions that specifically emphasized yoga meditation or mental relaxation compared to interventions that did not. And lastly, controlling for other moderators for diastolic blood pressure only, greater blood pressure reductions were reported among interventions that prescribed yoga at higher frequency. So putting all these moderators together, we have estimated what is the largest potential and clinically relevant blood pressure reduction from yoga practice. And we found that among individuals with hypertension and when yoga is practiced at 3 sessions per week, if yoga breathing techniques and meditation or mental relaxation are both specifically emphasized, yoga practice can result in blood pressure reduction as large as 11 mm mercury for systolic blood pressure and 6 mm mercury for diastolic blood pressure. However, if yoga breathing techniques and meditation or mental relaxation are not specifically emphasized, yoga practice will result in blood pressure reduction of 6 mm mercury for systolic blood pressure and 3 mm mercury for diastolic blood pressure. These findings suggest that yoga can be used as an alternative antihypertensive lifestyle therapy to aerobic exercise, especially for those who are unwilling or cannot perform aerobic exercise, which is regarded as the gold standard of lifestyle therapy to prevent and treat hypertension. And when yoga is used to lower blood pressure, make sure to emphasize yoga breathing techniques and meditation or mental relaxation to maximize its benefits. In our review process, we have identified several limitations of the literature, and most importantly, future primary level intervention studies need to have better reporting of their research methods. For example, intensity is always an important factor to be considered while looking at any modalities of exercise and the blood pressure response. However, in our sample, only 2 yoga intervention studies disclosed the actual intensity of yoga practice. In our meta-analysis, we did not directly compare yoga to aerobic exercise. Therefore, to confirm our findings, well-controlled randomized controlled trials that directly compare the blood pressure response to yoga and aerobic exercise while matching the volume of exercise with a non-inferiority study design are needed in the future. And lastly, even though our meta-analysis has the largest sample size to date, we only included articles published in English. Therefore, future meta-analysis should consider including articles published in languages other than English to have a more comprehensive review of the literature.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.